Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm going to provide a slightly different update this week for the COVID-19 pandemic. One of the viewers has pointed out that by not addressing some of the most important issues up front, I may lose some folks' interest. So this week, I'm simply going to address a question that comes in periodically, which is how can I help a colleague, a loved one, a friend, family member decide to get the vaccine? How can I help encourage someone to do something that I think is the right thing for them? So I think there's three steps in this process, and I'm going to just tell you what I think. This isn't the official CDC information. I'm not an expert in behavior change. This is what I think. There's three steps to this process: understand, provide, and facilitate. Understand why someone is hesitant to get the vaccine. Understand their reasoning. Provide relevant facts, what you think are correct information, and facilitate the process. So let me explain each of these. Understand why they're hesitant. Well, there are really two reasons, I think, why people are hesitant to get a vaccine. One is what I would call cultural, and one is informational. Cultural is someone who believes that the system hasn't treated them fairly for whatever reason. This is clearly understood with African Americans, recent immigrants, Native Americans, and others. But it's also true of a lot of other folks. Some evangelicals feel that the system hasn't treated them fairly. Some rural Americans, some poor Americans. It isn't for us to judge, but if someone has these feelings, that's important for you to understand. The second reason they might be hesitant is informational. They have heard things or think things that may be different than what you have heard or think. So, and these tend to fall into a number of areas. That the pandemic isn't that bad. I'm willing to take my chances. These are reasons that people don't want to get the vaccine. The vaccines are not yet approved. They've been rushed to approval. I'm worried about side effects. I don't want to violate my political or religious alignment. It's a violation of personal liberties, or it's part of a conspiracy. So let me address each of these quickly. The pandemic isn't that bad. This is a hard one to argue against because in the beginning, when people were saying this, it was basically true. It was a relatively small problem. But today we've had about 620,000 deaths in the United States alone. How do you understand that? Well, that's about the same as all of the soldiers killed during the American Civil War, more than all the soldiers killed in World War I, World War II, Korea, and Vietnam combined. It's more than all the cancer deaths in the United States each year. It's more than the deaths of injury, stroke, diabetes, and Alzheimer's disease combined. It's greater than the populations of many of our big cities, and certainly well greater than the population of the Tri-Cities. Now, some people will say, well, isn't it true that they're just misclassifying? Well, I've addressed this in a YouTube earlier. I'll put the link here and in the email. So if anyone wants to talk about excess deaths, you can point out that, in fact, there have been more excess deaths than those attributed specifically to COVID-19. In terms of I'm willing to take my chances, and you say that's understandable, but when you take your chance, you're taking other people's chances too. In other words, other people are being put at risk because of the decisions that you make. You may be willing to take the chance of getting COVID, but are you willing to take that chance to expose your elderly relatives, friends, neighbors, and so on? So it's important for people to understand that their chance taking isn't limited to themselves. And while it's true that the vaccines are not yet approved, they weren't really rushed to judgment. Everyone points out that all the usual steps were taken. There were tens of thousands of people in the trials. But even more importantly, since then, almost half of Americans, 150 million people, have received this vaccine. There's a tremendous amount of information about the safety and effectiveness of the vaccine. About side effects, of course, everything, every vaccine, every drug has side effects, and that's absolutely true. Most of the side effects from COVID-19 vaccine, the vast majority, are local, pain and so on. There have been some reports of more serious side effects, but they pale in comparison to the side effects of COVID-19, the disease. And I want to point out something that people don't often think about, and that is we don't know yet what the long-term consequences of COVID-19 are. We know there are some people who have long-term consequences. We don't know exactly what they are. So yes, there are side effects, but at this point, it appears that the side effects of the disease are considerably greater than that of the vaccine. The political and religious argument is an interesting one because, in fact, it doesn't really hold water, right? If you think about it, you could make the case that the COVID-19 vaccine was one of the successes of President Trump's administration, Operation Warp Speed. By media reports, the president, his wife, his daughter have all been vaccinated. And of course, you can make the argument that the COVID-19 has been a major initiative of President Biden. It seems like it would appeal to people on both sides of the political spectrum. In terms of religious alignment, there are very few religions, there are some, but very few that actually have statutory or theological arguments against vaccines. Sometimes there are some arguments against components of vaccines, but in this case, they don't apply to COVID-19. I put a link down there that lists those religions that do have an opposition to vaccines. And I would remind you that there was a survey done in January that reported that the vast majority, I think over 90% of evangelical ministers said that they would get the vaccine, and over 80% said they'd recommend it for their congregation. In terms of personal liberties, this is a mixed argument. Early on, when people were denying the pandemic existed, then when it became clear that it was a pretty serious pandemic, they switched to say, well, wearing masks, social distancing, shutting businesses down is a violation of my personal liberties. Vaccines are not a violation of personal liberty because at this point, it's entirely up to the individual. You can say it is your liberty to choose or not to choose to get this vaccine. In terms of part of a conspiracy, there's so many conspiracies out there. I can't address them all. I put a link here to a short video I did on how to deal with folks who have believe in conspiracies. You have to just deal with it as any other piece of information. If you can refute it with accurate data, you can do that. If not, you just have to deal with it. Now, there's one more type of argument that you'll get from people, and that's basically any of the above. These are folks who have made the decision that they're not going to get the vaccine under any circumstances, no matter what you say, no matter what the data show. And that's fine. That's their choice. It's a personal liberty. And if someone is in that boat, they're going to just go from one excuse to another. I wouldn't even worry discussing it with them and hope for the best for them and others. So understanding why people are hesitant is the starting point. Then provide relevant facts. And here, it's really, really important to remember that to the person you're talking to, their point of view, their argument, is legitimate and rational. All right? Whatever they believe is what they believe. So there's no value in arguing or nagging. The best thing is to hear what they have to say and say, okay, I understand that, but here's how I interpret it. So I always start with, I understand, or that makes sense, but here's how I think about it. Or here's what I've learned. And then share the facts that you think are relevant. It's no use arguing with somebody. And certainly no use demeaning someone or insulting them. Accept that people believe what they believe for a reason. Try your best to help them see other reasons. But if they don't want to, or if they can't, that's okay. And finally, facilitate the process. And that means find out where vaccines are being given, offer to drive them to the vaccine, offer to hang around if they're not feeling well. That'll help address some of their concerns. But at the end of the day, thank them for listening to you. Even if they don't get the vaccine, try to maintain their support. Because as bad as COVID-19 has been and is, the next disease might be even more serious. And if you can help people understand the rationale for getting a vaccine, for taking appropriate safety precautions, then you've done a good deed for the future, if not for the present. So if you have a friend, family member, loved one who doesn't want to get a vaccine, understand, provide, and facilitate. Understand why they are hesitant, provide relevant facts as you know them, and facilitate the process. If I can be of any help, particularly in providing relevant facts, please let me know. There's a great deal of information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please contact Jan Stork. As always, I'd like to thank Dara Young for editing, producing, and posting this video. And if you have any questions about this topic or any other topic related to COVID-19, please let me know. I'll do my very best to provide you accurate information. Thank you for listening, and please be well. Thank you very much.